Our ongoing work in a variety of areas following several natural disasters here on the island will help to establish community resiliency and provide support. Our team is working in collaboration with our clinical colleagues here in Puerto Rico to determine the best approach in caring for people living with chronic medical conditions.
We partner with the University of Puerto Rico and the Puerto Rican government to bring pharmacists to support with the outreach.
RWJBarnabas residents and our residents are taking care of patients that have been through natural disasters and other situations that are very challenging to them.
We value the collaboration we have been establishing with RWJBarnabas Health. I think that this model, it provides us the opportunity to do collaboration both ways, in which residents from your institution can learn from our context.
I will say the School of Pharmacy, as any other health professional school, has many goals, but the main goal is to develop our pharmacy professionals with the knowledge, the attitudes, and the skills to provide the best health care possible to our patients in Puerto Rico and to any other patients in the world.
We have different resources where we practice, but we face the same kinds of problems. And I think we're able to identify with each other from that respect. And we've been able to learn from each other a little bit, and I think take back some things we'll both be able to use to improve how we provide care.
I think it's always a little nerve-wracking and unsettling when you're going to an area that maybe you've never been before. People aren't comfortable being uncomfortable. By pushing yourself at the end of the day to be uncomfortable, you are gaining those valuable experiences that can help you further yourself not only professionally but personally. And at the end of the day, that is helping reach our goal outcome of patient care.
This kind of interaction with other residents from the United States is very important, not only because you're learning about our healthcare system, but we also learn on how you do the different services back in the States.
You know, when you go into an entirely different environment, it forces you to take a wider view of what you do, what your practice is, and why you do it.
Anytime you exchange ideas with professionals like the residents that come from your institution to share ideas with us, we also learn from your context.
Sometimes we wait for governments or other entities to do the job, but we can also contribute and help one another teach in every aspect of life.
Medical residents from our sister hospital, St. Barnabas Medical Center in New Jersey, will continue to volunteer with these efforts for several months.
Following this visit to Puerto Rico, the world began to feel the devastating effects of the global outbreak of COVID-19. While our work on the island is far from complete, we have been forced to pause our collaborative efforts due to stringent travel restrictions. Once we are able, we'll return to the island to resume our mission as soon as we can.
RWJBarnabas Health. Let's be healthy together.